and welcome to the VSC Healing Begins Here podcast series. The Victim Service Center, or the VSC, is a nonprofit organization that provides free, individualized counseling and other services to survivors of any kind of trauma in Central Florida. My name is Jenarine, and this episode we will be discussing the Black Maternal Mortality Crisis. Maternity should be a time of joy, hope, and anticipation. But for many Black mothers in the United States, it has become a period of heightened risk and heartbreak. Black mothers in the U.S. are up to 3 times more likely to die from pregnancy-related complications than white mothers. And throughout this episode, we'll hear from an expert and an advocate who have been directly impacted by this crisis. So to start, let's start with Jaimie. Jaimie, thank you so much for being here today.
Thanks for having me.
To start, can you share more about who you are, the work that you do, and why you're so passionate about this topic?
Yeah, my name's Jaimie Homan. I'm a victim advocate and crisis counselor at the Victim Service Center of Central Florida. So we provide crisis counseling, criminal justice support and advocacy, and counseling for survivors of all types of trauma. I got involved with this issue in particular as a new mom, kind of learning about this mortality crisis for the first time, and understanding that we are the #1 nation of we have the highest rate of maternal mortality among industrialized nations, and then learning that for Black mothers that risk triples. It just was something that I was shocked to learn, and I thought, why isn't everybody talking about this? And the other reason why is I got involved with a local organization that works to reduce these disparities. So.
That's amazing, Jaimie. And we were just talking about this, but I was doing some research the other day, and I found that in 2020 there were at least 800 maternal deaths every day worldwide in 2020, and that equates to about 270,000, which is absolutely insane. Mm-hmm. So based on your experience, based on your research, what would you say are some of the key systemic factors and societal factors that disproportionately affect Black mothers in the United States? And how can victim advocates effectively help to overcome these barriers and resolve this issue?
Mm-hmm. I think there is a debate among healthcare professionals about the causes of the high maternal mortality rate in general, and then the racial disparities. But I think we have to talk about systemic racism, mm-hmm. gender bias, and gender oppression. And those topics are kind of scary. So to put it in context, to give you some examples, I think there's kind of a lack of access to adequate care. And then B, there's, once you get in that care, are you being listened to? Are you being understood? Are your concerns being taken seriously? And I think, a lot of people don't think, racism looks really big and loud, but it can be these implicit biases that cause mothers to not be heard in these settings. And so I think that's the #1, and I think research shows that is a cause of the racial disparities. Also just systemic factors related to historical oppression. So you've got increased chronic stress and environmental risk factors associated as well.
Can you share some success stories or examples that have shown how victim advocacy can help reduce the Black maternal mortality rate?
Yeah, I love this question because I think this is a preventable issue. I think this is a fixable issue, and so that's exciting. And when I was a new mom, I got involved with an organization called Common Sense Childbirth, and Jenny Joseph is the midwife there in charge. And she has done a ton of work over the past few decades working with mothers in an at-risk area of Central Florida, and underserved populations, people who are underinsured or uninsured. And her outcome studies show improved outcomes for everybody, for thousands of mothers, but also an elimination of racial disparities. Her approach, I think, is a very client-centered or patient-centered approach. It's very much about empowering mothers to use their voice, to use their choice, and to receive an education, about motherhood and what to expect and what ways they can improve their outcomes.
What would you say are some of the most common challenges that Black mothers face when seeking adequate maternal health care? And what can individuals and the community, like victim advocates, and also the healthcare community can do to address these challenges?
Mm-hmm. I think this is an issue that affects everybody's going to have to start talking up about or speaking
Right.
about this issue because it is an issue that affects us all, and so that's one of the reasons I'm so passionate about it. But for Black women in particular, I think there's lack of access, but then there's also that implicit bias, and so I think it's a problem that we have to address on an individual basis. I like how you asked that question. On an individual basis, I think I'm passionate about sharing with individuals what the choices are, because there are organizations out there that are employing these patient-centered, evidence-based approaches that improve outcomes. And so knowing what's out there, knowing what the options are in your area is important, and being empowered to, I think, use your voice. Like, no, there's something going on. I need you to talk me through this healthcare concern that I have. On a systemic level, I think, obviously, there's lack of access to healthcare. That's a huge problem in this country in the first place. So continuing to talk about that, continuing policy advocacy about that, but also I think training and employing those methods that we know do improve birth outcomes.
How can advocates and community health partners, such as like other victim services agencies and policymakers, how can they collaborate together to reduce these racial disparities so that Black mothers who are, going to healthcare providers, like how can they feel safer? Yeah.
I think the first steps that we have taken as a nation, there's 44 states that have something called a Maternal Mortality Review Board or Review Committee. And those things, that's important to collect the data. Like, why is it? Because there was a lack of research about why mothers were dying in the United States. And so collecting that data and then collecting data on, for the organizations that are employing these, different models of care for prenatal care, why are they experiencing improved outcomes and what does that look like? And actually a lot of the methods that these patient-centered models of care are using are low cost and they're low tech, so they are feasible for us to look at. So I don't know if that answers your question.
It does. Okay. And Jaimie, thank you so much for answering these questions. Your passion, like when it comes to maternal mortality and the research you've done, it's amazing. And thank you so much for the work that you do in the community.
Yeah, thank you. Thank you for having me.
When we come back, we will be joined by Ebony Pritchett, who is a survivor and a professional. So don't go away. Welcome back to the VSC Healing Begins Here podcast series. In this segment, we will be joined by Ebony Pritchett, who will continue this conversation by sharing her experiences as a survivor and professional. Ebony, thank you so much for being here today.
Absolutely.
To start, could you share with us more about who you are, what you do, and why you're so passionate about this work?
Absolutely. So my name is Ebony Pritchett, as you said. I am a mom of boy-girl twins who are now 9 years old and a 3-year-old little girl. And as far as my profession is concerned, I am a market researcher, and I actually focus on underserved community groups and try to advocate for the voices of the underserved and the muted.
As a Black woman, could you share about your personal journey and, the complications that you may have experienced during your childbirth, like with your twins?
Absolutely. So what's really cool about this is to be able to talk about the experience that I went through. I think that when you are a new mom, you don't know what you don't know. Mm-hmm. And so you don't know what questions to ask. Mm-hmm. And so when I was having my twins, there were so many things that was happening to my body that I didn't know was happening, and I didn't know when to speak up, and I didn't know when to say what was wrong or to call out the doctors when they weren't giving me the attention that I needed. And so fortunately, I had my mom who was there, who helped advocate for me and who spoke up for me. But in this last instance with my 3-year-old, I think one of the most frustrating moments was when I was at home alone with my 3 kids because my husband was traveling for work. I was having contractions and I felt like I was going into labor. And so what my experience was is when you call the doctor who is on call, they call you back and they let you know like what to do when you're experiencing that. Well, for me, I called the hospital and I called the doctor and they said they were going to call me back. And then 40 minutes would go by, I'd call back, they said they were going to call me back. And this happened for over the course of about 3 hours.
Wow.
And my physician never called me back. In fact, the operator was so apologetic, like, I don't know what's going on. I don't know why they're not responding. I'm just going to stay on the phone with you. And while I was at 2 o'clock in the morning, I had to call somebody to come and watch my kids while I drove myself while I was having contractions to the hospital because my doctor never called me back. That was a very scary experience for me because I didn't know what was going on. My doctor wasn't calling me. She wasn't responding, and there was no reason for it. And alone because my husband wasn't there with me. Fortunately, I'm here to tell the story about it and explain it because that was a very scary experience, not to mention that because you do know the crisis that's going on when it comes to Black women and their voices not being heard, I was very scared of my survivor rate. Mm-hmm. And if my kids would have their mom to come back to after I had my child. So,
how has this experience shaped your advocacy for improved maternal health care?
Absolutely. I think, like I said before, a lot of women don't know what they don't know, so they don't know what questions to ask. They don't know when to push. And so a lot of my friends are asking questions who are having babies now or getting pregnant, and they don't know when to push back against their doctors or when they should get extra care. And so that's the voice that I'm providing to them. I make sure that I speak up. Like if they don't know, I'm telling them, okay, it's time for you to go to another doctor. It's time to reach out to someone else. And even to the point to where one of my very good friends and I, we actually created an Instagram page or channel, if you will, where we were actually speaking out to new moms and older moms alike who are just trying to figure out their way through and when to push back and ask questions.
What support systems or resources have been most valuable to you, like after you gave birth and when you realized that, oh my gosh, I didn't receive the health care that I needed, to have that safe delivery and to feel like you belonged and you were taken care of? What resources and support were most valuable to you after you gave birth and as you were healing?
I'm fortunate to say that I'm surrounded by allies and advocates for women of color and moms, and so my friends, my community has been there. One of my friends, in fact, Jaimie, has been a support for me, who's been there for me. And then other programs that exist. I know one problem that exists out in the world today is after moms have a child and if they're in a marginalized community, a lot of times they don't have care to take their children. They need to go to work, but there's no care, and child care is so expensive. But what I'm learning is that there are some program assistance that's available through the government, but sometimes you have to try to go and find them.
Right.
So.
What would you say are the most critical changes that are needed in healthcare today to help support Black mothers during pregnancy?
That's a loaded question because there's so much. Well, for one, I think just the education of just starting with education. I think one thing is that it's taught that maybe it's not taught, but I think there's a perception that Black women their pain tolerance.
That's a big one.
Yes. Black women's pain tolerance is a lot higher than other people. And so when they say that they're in pain or they're uncomfortable, they might be ignored. And so the education system, I think we got to go all the way back and start educating a little bit differently and even realizing that there's some bias in the education system when it comes to doctoral care.
What would you say, or how can community organizations like victim services, like domestic violence shelters as well, even like in the research that you're doing as it relates to marginalized populations, how can all of these entities collaborate to ensure, to bring, this awareness and to help influence policies within like the healthcare setting to make sure that mothers and, Black mothers in particular are receiving the care that they need?
That's a really great question. I'm glad to say that I've seen that happening. I've seen like different organizations coming together, but I really think it's about going into the spaces and the places where these moms are in order to spread the awareness about what is available. Like I said, I'm like some people don't know the type of assistance is available in terms of just getting diapers or getting supplies and getting the things that they need. They don't know where to go and where that's available to them. So I think one of the biggest things that we've been talking about is how can we make sure that we're showing up in the places that these women are and they're becoming a part of the conversation. That makes sense.
Yeah, it does make sense. And for my last question for you today is, what is one piece of advice you would give to a pregnant Black mother who is, getting ready to give birth? What is one thing that you would tell her?
I think sometimes we tend to carry our burdens on our backs and maybe not talk about it. And one thing that I have found is the more I talk about it, the more people relate and they're like, oh my gosh, I went through that too. I didn't even know that was a problem. And so what I would say to a new Black mom is, if you're struggling, if you have a question, don't ignore it. Actually ask the question, turn around and talk to somebody about it, because chances are somebody else is going through it or has gone through it and they have an answer. But the longer we stay silent about it, the longer this problem goes on.
Thank you, Ebony. Thank you so much for sharing your experiences, as a survivor and a professional. We appreciate you.
Absolutely.
In our next and final segment, we will be joined by Melissa Tran, who specializes in prenatal mental health, sexual trauma, and relational and systemic therapy. Welcome back to the Healing Begins Here podcast series. In this segment, we will be joined by Melissa Tran, where we will be discussing the importance of evidence-based practices and how mental health providers can collaborate to ensure that Black mothers are receiving the care that they need. Melissa, thank you so much for being here today.
Thanks for having me.
Of course. To start, can you share with our audience more about who you are, the work that you do, and why you're so passionate about this topic?
Sure. So I'm Melissa. I am a licensed marriage and family therapist and military sexual trauma coordinator at Orlando VA. I came into this space because I think, like a lot of us, with our own personal journeys and struggles with maternal health and navigating that process, it wasn't easy. So with my challenges, I found gaps in care that really needed to be addressed, and it called to my heart. And so I made it part of my mission to really get involved in this space and expand perinatal care for everyone.
How do mental health challenges such as prenatal mental health disorders and trauma intersect with the risk factors that Black mothers face when giving birth?
I think we have to talk about the reality, and Jaimie talked about it earlier, so amazing, about the systemic racism and microaggressions experienced, macroaggressions that are experienced leading to trauma in our bodies. And so when Black people and communities experience this, they might be less likely to ask for help, receive care, and trust in the care that they're told they're supposed to get. And so if you don't trust in your providers, why are you going to go?
Right.
And then we're seeing a lack of access to care in health inequities and social determinants of health. So we really need to make sure that that's being addressed. Otherwise, without the care, we're at more risk for developing mental health concerns or not receiving care that's needed, leading to more unfortunate outcomes.
Can you explain the importance of addressing, I know you touched on this, these issues as more of like a larger comprehensive program for addressing maternal health care as it relates to Black women?
I think recognizing, so I run a mom's group.
Ooh.
And one of the big things that is constantly shared in that group is, I thought I was the only one. I feel so alone. And I think we need to address that issue of making sure these services are available to everyone and that people know about it. Great services are available, but if we're not educating on what's out there and what's available, it doesn't matter if they're not being utilized. So I think that's a systemic thing that really needs to be available.
What are some evidence-based practices and therapeutic approaches that you've seen in your line of work and your experience that has proven to be effective when working with Black mothers who are experiencing trauma, who are experiencing systemic biases, gender bias, racism, etc.? What would you say are some evidence-based approaches?
Clinically, if we're talking about treatment, interpersonal psychotherapy, there's the model for reproductive mental health, which is transdiagnostic, so you can address the symptoms that people are experiencing. And within that framework, we talk a lot about culture and identity and values, which is really important to include when we're talking about people of color. Because not one size fits all,
Right.
and we want to be really sensitive and culturally competent in
Really,
those
right.
care that we're offering. Other treatment modalities, cognitive behavioral therapy is an evidence-based practice as well. One that I really like for trauma is cognitive behavioral conjoint therapy for PTSD. That one's great because you have the survivor, and then you can also include a partner, a trusted source of support. So you're doing that alongside somebody in that treatment, which is really wonderful. Supportive treatment approaches, peer support, support groups, psychoeducation, mother, infant therapies, things like that are also available and helpful.
That's amazing. How can mental health specialists and healthcare providers collaborate to ensure that the best care is given to Black mothers so that when they are, giving birth, they feel safe, they feel like they belong, and they have the sense of, okay, I know that I'm going to receive the care that I need?
Well, my magic wand, if you will, would say, can we stop with racism? But we know that that is embedded, unfortunately, and we are continuing to strive to help to challenge systemic racism. Beyond that and implicit bias education, I think starting before pregnancy with education, we know that half of pregnancies are unplanned. So where's the education involved in that?
Right.
We also know that perinatal mood and anxiety disorders can start preconception or pre-pregnancy. So where's the education on that? Making sure people know and are aware of resources that are available. Embed mental health providers in these other clinics. I've seen infertility clinics that have perinatal mental health certified professionals in their clinics, and OBGYNs working hand in hand with mental health professionals. I think that's really important. Early screening and often screening. Not just at a 6-week follow-up, but more often than that, vulnerable times, right after postpartum, and 6 to 8 months postpartum. That's a high-risk time for potential self-harm. So risk and screening need to be combined to where it's at the right times, and so up to 12 months postpartum, frequent screenings. I think it's really important.
It's very important. And in your experience, what would you say are some key strategies in promoting resilience and well-being among Black mothers, when they're going to the hospital, when they're going to give birth?
Find your support network. That is such a key strategy. Know that you're not alone. Find your helper people and advocate. Get a doula. Get people on your side to stand up for you if you are in a situation that you can't stand up for yourself. Have a birth plan ready. Have your plan ready and let everyone know. And speak your truth of what you need. Your life is the most important thing, and your baby's life is the most important. So I don't care if you inconvenience or annoy someone if you come out safe and alive.
Melissa, thank you so much for being here. Thank you so much for sharing your expertise and your experience with our audience. We appreciate you.
Thanks for having me.
If you would like to learn more about the VSC and our free services, please visit victimservicecenter.org, call our office line at 407-254-9415, or call our crisis line at 407-500-HEAL. And to everyone listening, healing is not linear, and you are not alone.